Well, hello. Welcome to today's Coag Coach teaching case. I'm Toyosi Onwuemene, a hematologist and Coag specialist. I'm happy to bring to you cases that help you in your practice to provide better care for your patients. So today's case is the case of a 49-year-old man with iron deficiency. And this man has had treatment for iron deficiency. And in fact, his primary care provider has been extra cautious as far as trying to figure out the source of blood loss. And so he's been referred to gastroenterology. There's been an upper and a lower endoscopy with no source of bleeding found. This person received a gram of IV iron with complete resolution of anemia and iron deficiency, only to come back a few months later and iron deficiency is recurrent. And so the question this primary care provider has for me is, well, if we can't find a source of bleeding in the upper GI tract or in the colon, then it must not be bleeding. What else are we missing? And I want to say, what a great question. And we absolutely should answer it. So last week, I talked about how whenever you think about iron deficiency, there are causes other than bleeding. However, in a man with iron deficiency, especially when you supplement iron, there's clear evidence that there's been replacement and then there's recurrence. It tells you that bleeding is the most likely. And guess what? This person is actually on a therapeutic anticoagulant, which makes it all the more plausible that what we're dealing with here is blood loss. Now, why do we think it's blood loss? Well, first, it's happening so fast. If within a few months of repleting this person, you're down to iron deficiency again, so granted, this person has not had anemia recurrence, but they're iron deficient. So it means that they're losing the iron. And so even if absorption is a problem, you've got enough iron stores for a few months to think about before you start to see the effects of not having absorption. So, iron deficiency is present and it's recurrent, and the person is on therapeutic anticoagulation. It probably is bleeding. Now, remember, it doesn't have to be profuse bleeding, it doesn't have to be profound bleeding. It can just be a little bit of bleeding at a time to be able to see that level of iron deficiency shortly after you've repleted somebody. So, what am I saying? Yes, an upper endoscopy has been done and a lower endoscopy has been done, but this person still has iron deficiency. Therefore, the question is, where else is the blood loss potentially throughout the gastrointestinal tract? Now, here's the reason why it's important to find the source of blood loss. You want to find the source of blood loss because you want to address it. You want to address it. So you're looking for a source of blood loss you can address. And if you can find and address it, that means this person can safely continue on therapeutic anticoagulation without problems. If you don't address the source of blood loss, then they're going to continue to bleed over time, and you're going to be stuck giving them iron supplementation on a recurrent basis. Now, you can do this. You can replace iron parenterally for a few months at a time. But if this becomes the person's lifelong story, if this is a chronic every few months I go in to get an iron replacement, it can be challenging. It can be challenging for the person to be compliant with or adherent with therapy. And that's why you want to find the source of blood loss. You want to address the source of blood loss and release the patient from having to come in for iron supplementation on a regular basis. It is challenging, but it is important. Now, what if you are not able to address the source of blood loss? Well, then you have to consider what you're going to do about therapeutic anticoagulation. Is it absolutely required? How long is the course of anticoagulant therapy? Has this person completed the course? Are they candidates for secondary prophylaxis, or is there an indication to stop treatment? And that's going to become important over time, especially because if there's a source of blood loss and it's very, very small right now, the time is coming when it might really open up and bleed. And you want to address that before that happens. All right, that's been our case presentation for today. Again, when you see iron deficiency anemia in a man, think blood loss. And when you do an upper endoscopy and a lower and a colonoscopy, and you still have evidence of iron deficiency, ask yourself, what other imaging of the GI tract is necessary so I can definitively rule out and address blood loss, and or start to think about what I'm going to do to address therapeutic anticoagulation in somebody who has a potential source of ongoing blood loss. All right, that's our case for today. I look forward to talking with you again next time on tips and tricks for providers in caring for patients with hematologic disorders?